as the granddaughter of somebody who committed suicide in my family, but also to acknowledge my very good friend Louise Gizzy, who was a great Labour supporter from the trans community, who took her own life earlier this year and is in the group that represents the highest number of people who commit suicide in this country, between 5 or 6 times that of the general population, depending on which research you read. And so we are going to support this legislation, but with a challenge really to the government members, because everything I've heard opposite makes sense. That sounds great. To have a strategy is good news, but without a workforce plan, without funding, without transparent procurement, without localised solutions to mental health, the strategy is at risk of sitting on the shelf gathering dust as we continue to experience this really shameful crisis in our country that is the mental health crisis, particularly of our youth. So we are supportive, Mr Speaker, but we are also sceptical, because we are now, nearly 9-10 months into the electoral term, and we know that the biggest challenge facing our mental health sector is workforce, and yet I have yet to see a workforce plan. Where is the workforce plan, and where are the workers that are going to bring about the changes that this strategy will hopefully bring to the front line? We haven't seen that. We know that we are desperately short of workers across the board. We know that despite assurances from the government that there is no frontline freeze, that there are hiring freezes, certainly in my electorate entirety in Southland, where advertisements for mental health nurses have disappeared, where pregnant women who are in the mental health sector, nurses that I door knocked on the other day, said they could not, as a full-time FTE, get somebody to take over part of their shift because there is an effective hiring freeze. These are the nuts and bolts, or the devil in the detail, of a strategy that will make the difference. So it's good to have a strategy, Mr Speaker, and I'd just like to clarify that the reason the Labor government didn't include one originally is because the other population strategies are around population groups, and the landscape of mental health provision is at risk of becoming cluttered if every single group has a strategy. On this side of the House, we believe that mental health is cross-cutting. It impacts on every part of Ora, as the previous speaker has said, and so there was no need to carve out a specific strategy. But we have listened to the submitters. We agree that a focus on mental health and a strategy is a good idea, and what we are waiting for now is the workforce strategy and the funding to support it, and funding to the front line, so that the community groups that are so desperately waiting for funding so they can continue the work they've been doing at the coalface for the last several decades can continue rather than them fold. So my challenge, Mr Speaker, is to the government members. Thank you for your words. Thank you for what sounds good. When are you going to back it up with action? When are we going to see funding? When are we going to see a workforce plan? And when are we going to see an end to the mental health crisis that so many of our rangatahi in particular are calling for? I commend it to the House.
She's a good speaker at 1.5 times speed, and you can still understand her.
Yeah, that I wish that was the case for me. So yeah, I just want to remind people what the purpose of Pae Ora Healthy Futures Act 2022 is about. So the purpose of the Pae Ora Act is to provide public funding to services that protect, promote and improve the health of all New Zealanders. And a key focus of this act was to eliminate health disparities faced by population groups such as Māori, Pacifica, rainbow communities, like what Ingrid just mentioned, rural communities, the disabled and the elderly. Now, to address her point, it is really unfortunate that the number of trans, non-binary and intersex people that commit suicide in New Zealand is not presented on Te Whatu Ora's suicide data web tool. This is a problem because they're being excluded. This needs to be addressed as transgender, gender diverse people and non-binary people are a highly marginalised group, and trans-specific factors for suicide is an under-researched area. My dyslexia got me there at the end. So yeah, that was a bit of research that I did on my part in regards to what she had said. Now, there was a really good statement that was put forward by the Mental Health Foundation of New Zealand. The MHF stated in their submission that New Zealand's national mental health and addiction workforce is vastly under-resourced, and a new mental health addiction wellbeing strategy will not be effected without due consideration to issues such as gaps in staffing levels and expertise across the whole system. So that's very important to note. These gaps mean people in need are at risk of not receiving support, not receiving enough support, or failing to receive, or they're going to be receiving inappropriate support, in turn increasing the likelihood of their well-being worsening and their recovery being stalled.
Yeah, it's going through that, and I do know my friend Ali up in Gizzy, who has worked in it for years, and it's always been on the bones of the arse up in Gizzy because they've got problems.
Yep.
But the biggest thing is they've always been understaffed.
Hmm.
Yeah. Oh, well, so should we now head to Francisco Hernandez and let's see how he's singing on the song sheet.